on. Oh, thank you for recording. Will be recorded and posted on the Fly and Classified Development YouTube channels, which we will send out the information to those recordings via email, along with the survey about today's activities. So now I would like to introduce Dr. Shauna Bigby, Director of Student Health Services, and Dr. Robert Samus, Director of Human Resources.
Welcome, everybody. Bob, if you could go ahead and stop sharing that, I'll put up our PowerPoint. Let's see how good I am at this. Come on. There we go. Share screen. Where did it go? Let me do this again. There we go. I think I have figured it out now. I'll move that over. All right. We're good to go. So welcome, everybody. For those of you who don't know me, I am Robert Samus, the Director of Human Resources, and Shauna somewhere in the virtual world and will be joining us. Welcome to our brief presentation on where we are with COVID-19. I have to tell you that I wish that my crystal ball and my magic 8-ball would work, because I have stopped trying to predict things. So we're going to give you information that is based on the best evidence and data we have as of today. So let me start my slideshow. So today what we want to do is address some of the current issues and trends, focusing on Los Angeles County, and where there are some differences in our surrounding counties, we'll point those out. Talk about where we are with vaccinations, and then spend some time addressing where the district has been and is currently with our safety response to COVID-19, what programs and staff are currently on campus, and then talk a little bit about a preliminary outline for an incremental approach to how we might look at reopening campus, both the students and staff. So the first part, I'm going to turn this over to Shauna to talk a little bit.
Good afternoon, everyone. For those of you who don't know me, I'm Shauna Bigby. I'm the college nurse, and I'm going to give you a brief update on LA County trends and vaccinations. So currently, Los Angeles County is just coming out of its third wave. The following graph will show our progress. Dr. Samus, you can go to the next slide. The third wave was the largest and the most deadly thus far. To compare, our highest hospitalization in Los Angeles County in the summer was just over 2,000. And during the winter surge, it was over 8,000. So you can see from December to January how it peaked and how it's declining, which is good news. We're on the decline. Next slide, please. Since the California stay-at-home order was lifted on January 25th, we are back to the tier system. Los Angeles County remains in the purple tier, which is the most restrictive tier. We have met the positive test metric to move to the red tier, but our case rate is in the 30s per 100,000 and needs to fall to 7 per 100,000 in order to move to red. Next slide, please. So this is what this looks like. Targets for tier 2, or the red tier, are as follows, and needs to be sustained for 14 days. The adjusted case rate target for tier 2 is less than 7, and currently it is 31.7. The test positivity rate target for tier 2 is less than 8%, and currently it is 9.5%. The equity target for tier 2 is less than 8%, and currently it is 13%. But the good news is the regional ICU target was greater than 15%, and currently it is 20.6%. And so the ICU capacity target is the available ICU, the number of available ICU beds. And the equity target is basically because minority groups have been disproportionately impacted, they have higher positivity numbers and death cases of death. So they want to make sure that that comes down. Next slide, please. Can you hear me? Oh, yeah, there we go. So this slide shows numbers to date. You can see that Los Angeles County has had over 1 million positive COVID cases and over 19,000 COVID-related deaths. The 1,869 newly confirmed cases are as of yesterday, and 29 deaths were reported yesterday, which those numbers have come down significantly as well. Next slide, please. Now to the good news, the COVID-19 vaccine update. Los Angeles County, as informed by California's vaccine prioritization policy, is operating on a tier system for COVID-19 vaccine distribution. Currently, we are vaccinating those at highest risk for either contracting COVID-19 or succumbing to it, which include those folks over 65 years old and those who work in healthcare settings. So far, Los Angeles County has given over 1 million doses of the COVID vaccine. Next slide, please. Who's getting vaccinated now? So phase 1A, healthcare workers, long-term care residents. We are currently also vaccinating in phase 1B, but due to limited vaccine shortage, they haven't moved to the sector populations yet. So they're currently only vaccinating individuals 65 and older. Education, agriculture and food, and emergency services are in the second group. And so it's kind of a standby. They were supposed to start this month. Some counties have it open, but LA County hasn't moved forward yet. So,
yeah. Sean, if I may just add a little bit there. I know some of our individuals who live in San Bernardino County have been able to get appointments for vaccination based on their status as an education worker. It appears that Riverside and Orange are advertising that they're getting ready for education workers. But as Shauna said, all of this is contingent upon the supply of the vaccine. So you'll see on a lot of the surrounding county websites, they'll say that they are now vaccinating education workers, but they may not actually be appointments available. If you do get an appointment, some of the counties are requiring a letter from the college verifying your employment. And if that is the case, please do send me an email, and we have a form letter prepared that we can put your name in and send to you. Some counties are indicating that a pay stub may be sufficient, but we want to make sure that you have the documentation you need if you're so lucky to get an appointment. For those of you who are in Kaiser, Kaiser is still only vaccinating 75 and older, and that again is due to their limited supply of the vaccine. They do indicate on their webpage that as more vaccine becomes available, they'll drop down to 65 and older and education workers in that priority, again, as vaccines become available. Sean, anything else you wanted to add?
no, that's it. I turn it over to you.
Okay, thank you. So I wanted to kind of review where we are with programs and staff on campus. So starting in this summer, and consistent with guidelines from both the state and the county, we are able to bring on campus students to do labs that they cannot do remotely if the lab is designed to train them to be part of what's called the essential workforce. So that involves all of our health science labs in nursing, dental, CNA, EMT, and our automotive labs. Some of these labs cannot be replicated online. And so since the summer, we've had a limited number of students coming onto campus for these particular labs. As we moved into the fall semester, the number of individuals coming on campus for these labs has increased, particularly in the automotive area. All of that has been done with very strict protocols in place. The departments developed protocols based on guidelines that they were provided. Those protocols then have been reviewed with the Faculty Association as well as the COVID work group, and are consistent in every respect with what the county and state is telling us we need to do. It involves the use of an online app that's available on the Citrus mobile app, where students and staff do a pre-screening and get either a green pass, which is a go to come on campus, or a red pass, which prohibits them from coming on campus. And then for students, when they get to their classroom or go into a restroom, they scan a QR code. So we know where the students have been in the event that we have to do contact tracing. And we've had several instances where we've had to do contact tracing, and the information from that app has been very useful. And I do want to let you know that it is Shauna and her folks that do the contact tracing. And it's not an easy task, whether the infectious person is on campus or has been off campus. So I want to thank Shauna and her folks for their great work in that area. In addition to the faculty and students who are coming on campus, back again in late spring, early summer, we created two categories of people who can come on campus. One is what we call our ongoing essential employees, and this is through an MOU with CSCA, where employees in certain work categories or work groups can come on campus for a limited duration to do work that they cannot actually do from home. So we have people in student services coming on campus on a limited basis. Campus safety is back working on campus. Grounds is on campus. Custodians are coming on to clean those areas that we use for our labs and for employees. And we have folks in financial area and payroll who come on a limited basis. In order to do so, there is a process that everyone must follow. It involves completing a request for an ongoing essential employee. It also includes all the protocols of distancing, wearing masks, and doing a self-check on the mobile app. And it is something that we monitor constantly to make sure that we are creating a safe environment for those on campus. The short duration essential employees are those people who have to come on for a limited period of time. It may be a faculty member who needs to come in on campus to pick up some vital things that they have in their office. It may also involve a book pickup or mail pickup. So all of these things, as I alluded to, we are doing under very, very strict guidance and adherence to all of the safety measures that we have been told are best practice, both by the County of Los Angeles and the state. I will tell you that most of our detailed regulations come from the county, and they've been very good about laying out for colleges and universities what we must do. They also have been consistent with MOUs that we have developed with each of the bargaining units. We have in place what we call an exposure management protocol. This is available on the intranet. If you go to the intranet under human resources, you'll see a COVID link, and all of these safety measure documents and MOUs are there if you wish to go in and look at them in more detail. The exposure management protocol talks about how we respond to an infectious person on campus. It tells us how to respond if an employee becomes infectious but is off campus. And it talks about the quarantine process, testing process, and contact tracing. And it's very detailed with a lot of definitions and applications about how we proceed. So far to date, we've had approximately 4 infectious people on campus to which we've had to respond to. We've had countless employees who have become COVID-19 positive, but have been off campus and not exposed to any employees. Those individuals, Shauna reaches out to make sure that they're getting adequate care and have the latest information in terms of how to quarantine. Right now, we are still recommending that people who become infectious to quarantine for a 14-day period. Although you may have heard that the CDC and the county are now recommending 10 days. We're not quite yet ready to make that shift to 10 days, but it might be something in the near future that we're going to adopt after some more conversation with everybody. In addition to the exposure management protocol plan, we have a task force in place. That task force consists of all of the area vice presidents, myself, as well as Shauna, Dr. Bigby, as the Director of Health Services. And that group is tasked with responding to outbreaks on campus and making sure that we are adhering to all of our protocols. We also have our COVID-19 task force, which is a broader group of faculty, staff, and managers and people from a variety of areas that meets once a week to review where we are in terms of recommendations, in terms of how we could open, how we are doing with our labs. They review all of the protocol plans for each lab that is approved to come on campus. And then lastly, as I mentioned, there is a form for requesting an ongoing essential employee. It is an approval and an acknowledgement form, as well as for the short duration folks. As I mentioned earlier, we have our Citrus mobile app, which has a daily pre-screening feature to it, as well as a QR scanning. So we know when people come on campus, what building they have gone into. And that is essential for us to have people on campus. So if we were to have a person on campus who is infectious, we can tell where they've been and what employees or students they may have been in contact. And as we look at a greater reopening in the future, that capability will become extremely important in terms of any plans and protocols for having students and staff back on campus. We've also implemented a campus-wide communication process. So when we have a positive case of COVID-19 on campus, an email goes out to all faculty and staff. We also are providing direct support to students and staff who report COVID-19 infections, and that's done through with Dr. Bigby and her group. And we also engage in a continual review of current regulations and protocols. Tomorrow, we will be participating in a telebriefing with the Department of Public Health for Los Angeles County. And through those conversations, which are geared for universities and colleges, we get information about what the plans are looking like in terms of potential reopenings. We anticipate that the county may, in the near future, give us a very limited ability to have special groups of students in a very limited number on campus for instruction. That still is a little ways off, but we're hoping to hear more about that tomorrow. So I wanted to lay out for us a conceptual idea for looking at how we might return to campus, primarily bringing students back on campus for instruction. And the approach follows pretty much how the tier system that Shauna spoke about earlier. So right now at tier 1, which is the purple tier, where we are based upon the factors that Shauna went over, we are prohibited from having in-person instruction except for the student instruction linked to training for students for employment for positions in essential services like health services and automotive. If that continues into spring, summer, and fall, we will be in the current structure we are with all of our instruction primarily remote, with the exception of health services, non-automotive labs. Hopefully, we will get to a red tier, which is the next level. And once we get to the red tier, we are able to bring students on campus to a capacity of 25% or 100 people. Now, right now, Dr. Bigby and I believe that that cap of 100 is a total number. So it would be the number of faculty and students on campus for a particular instructional program. We're trying to get clarification if the 25% capacity relates to a particular classroom or if it's in total. They haven't really defined that for us. So under this, if we are under red, then starting in the summer of 2021, we could look at returning some limited number of students to campus for direct instruction. And we will get more information, as I said earlier, from the county in terms of what that might look like in terms of developing cohorts. So for example, what that might mean is that we might be able to bring in some folks who can't do their instruction remote, like performing arts, let's say a dance class, that would be limited in the number of students. And it would be a cohort that only goes to a particular part of the campus, cannot go to any other part of campus, but does engage in some instruction, particularly if we could do that outdoor during the summer. And then the same thing for fall. We have not identified what programs for the summer or fall might return under this limited category. That is something for conversation to take place in the not so distant future. If we get to tier 3, which is orange, that number of students and staff that we can have on campus would increase to 200. I should note that in addition to bringing faculty and students on campus as permitted, we would also count on bringing back classified staff who are directly necessary for supporting that instructional program for when they are on campus. Right now, if I had my crystal ball, I do not believe we will get to the orange tier by summer. The fall, possibly, but I'm not too optimistic about that either. And then the last tier is yellow. And under the yellow tier, we can increase to 50% capacity. Again, we don't know what that means. So when they write these regulations, when they're dealing with businesses or restaurants, they use this terminology of 25% capacity or 50% capacity. And it's easy to understand what that means in the context of a retail store or a restaurant. But when they use that language without defining it for a university or college, we don't really know what that means quite yet. We don't believe it means 50% of our total capacity as a campus. But as I said, we're trying to get clarification. So this incremental approach to reopening is based upon the tier structure. This all might change in the next couple of months or so as vaccinations become more prevalent and the county and state devise new regulations or new criteria for reopening universities. You may have heard today that LA County is opening K through 6. Again, that's not a blanket reopening. It is based on a permit process where a particular K through 6 program has to apply to the county for approval. But we are beginning to see some movement of trying to get education reopened. And with that, I will stop sharing and we'll kind of open this up for questions. I know there's a lot in the chat. I haven't been following it. Let me see if I can go to the chat. There is a question, does the Chancellor's office have any input in this? Not directly. The Chancellor's office has been supportive in terms of giving us, kind of reminding us of the guidelines, but we are going to be guided by LA County primarily. Another question, best estimate as to when we will be back teaching on campus. Thank you, Anna. If I predict this right and we put some money on it, we'll see who wins the bet. It is really, really difficult to tell. If I had to guess, I would say that fall will be a transitional time for us, and hopefully spring will be a time where we can start a more aggressive reopening. In terms of being back to full operation as we were before, I don't think that's going to fully happen until fall of 2022. Vaccinations is the key. All of us getting vaccinated, the community getting vaccinated, and how it will limit the community spread is key to all of this. Erin, a question? Yes.
There was there were a couple of other questions about being vaccinated. You have to, currently the counties are vaccinating their residents in the city in which, the county in which you live. So you can't cross counties. And there was one other question about if you were fully vaccinated, does that mean if you were, does it still count as an exposure? And it does, because vaccines are not 100% effective. We still need to practice social distancing, and you would still be quarantined. And I think that was it. There's one more question. Will students be required to become vaccinated?
That's a really good question, and it goes both ways. Will students be required to be vaccinated, and will staff be required to be vaccinated? Under our current employment and student laws, an employer may require staff and students to become vaccinated as a condition to being on campus, but we have to make exceptions for those who may have health conditions that prohibit them from getting the vaccine, or religious exceptions to that. I know that as we start looking more seriously at a reopening plan, I shouldn't say seriously, as we know the more detail of that, we will be having conversations with the Faculty Association about whether we require staff to be vaccinated. The recommendations right now from CDC is that we do not require staff and students to be vaccinated, but that we highly encourage people to do so. We are going to be starting a campaign from the COVID work group to send out a weekly or bi-weekly message to staff and faculty to let them know where people are with the vaccine issue and where we are with current trends, so we all have the information. We're going to see a lot of regional differences, so and it's a mess right now. There are big pronouncements about who can get vaccinated, but it's all limited by the number of vaccines. Any other questions? You can ask them.
A couple of other questions.
I have a question.
Sure.
Oh.
Go ahead.
Okay, so I'm so sorry. I tried to log in earlier and I was having difficulties logging in. So I missed part of your presentation. And so if I'm asking a question that is you've already covered, please forgive me. I'm wondering, does Citrus have a safe plan already in place that's been approved? And what assurances does faculty, staff, and students have that we're actually going to be safe on campus? Because I had a lot of problems just getting the trash emptied in my classroom or toilet paper in the staff bathroom. So what assurances do we have that we're going to be safe?
A good question. So we will not return students or staff to campus unless we are following the strict guidelines developed by the Los Angeles County Department of Public Health and consistent with state guidelines. For the limited number of students we have on campus and the limited number of employees on campus, we are following all of those protocols to a T, which include pre-screening, mask wearing at all times, social distancing, and cleaning of facilities that are used. There can be no guarantees. I will tell you that we have not yet had a case of COVID-19 that originated on campus because someone was exposed on our campus. We've had people who have come onto campus who are infectious, and we have dealt with that through our protocols to make sure that all those who were in potential contact had been quarantined, not permitted to come on campus for a period of time, and we have worked with them to get them tested. So we're doing everything we can. When we start looking at returning to campus with more students and staff, I will assure you we will only do so if we believe that we can follow to a T the safety protocols that are in place.
So Bob, I thank you for your answer. I do have two more follow-up questions, if you don't mind. Number
Sure.
one, I've heard that some of the community colleges have already announced that they're not going to, community colleges in California have already announced they will not be on campus in the fall. So I'm wondering how that's going to affect Citrus. And secondly, I'm wondering, my follow-up question secondly is, what's the protocol going to be in place to assure safety for everyone? And is that going to be shared with faculty, students, and staff?
Yes, let me take the last part of your question. Yes, all the protocols that we develop, we don't do so in isolation. They are reviewed by our COVID work group. They are reviewed with the employee organizations as well. We're not going to do anything that is not consistent with the best advice and protocols that we have from Los Angeles County Department of Public Health, which is the most restrictive. That's why when we look at reopening, it will be tied to the tier system. It will be very limited. Some of the UC campuses and the state university system has announced that they're going to be on campus for the fall. I think they're being disingenuous to their students, and it's a marketing ploy. No one right now can tell you how open or how close we are going to be for fall. Fall will be a transition semester. How much of a transition, how many students we have on campus, I would rather guess that it's going to be very limited and with very, very tight protocols in place, including a testing program for students and staff who are on campus.
So are you saying that in fall we may not be on campus?
I'm telling you that we don't know yet, but fall most likely will be a very soft return of a very limited number of students, consistent with the approach I laid out in terms of the tier structure of the county, in terms of what we're allowed. Remember that the decision is not ours. The decision is being driven by the Los Angeles County Department of Public Health. So we might start seeing regional differences where in some areas of the state, they're allowed to reopen faster. But LA County, unfortunately, historically has seen a higher number of COVID-related infections and deaths than other communities.
There are quite a few questions in the chat.
Yeah, let's see if we can get
If
to
you
some of
could-
these, Shauna.
Yeah, so is there a way to, let's see.
Actually, you know what?
Is there a direct protocol for submitting a proposal for the labs? If we could get a snapshot of these questions, then maybe Robert and I can send out a memo, because there's quite a few questions. Some we can't answer right now, but some are pretty.
Right. Let me just kind of go to one of the questions that kind of seems to be repeated. In terms of submitting a request to have a class on campus this summer, we will get a process in place where we start looking at that. It is not likely that the classes for summer would be lecture classes, but will be concentrated on areas where we know that we're not able to offer a class online. So, and I don't mean to pick on a particular area. So for example, dance or some performing art where we can do it outdoors with a limited number of people. So don't look, I would not think about summer as a return of lectures to campus, and fall might be, but in a very limited basis. And Nicole, you were started to ask a question. I want to give you
Well,
that
we only
opportunity.
had you two scheduled for half an hour, and we can see this. There's a lot more questions. I want to honor your time. You two agreed to do half an hour. We also have other workshops that are
Right.
starting at 1:30. So maybe we can do this again in the near future and also look at the questions that are being asked and communicate answers to those questions.
Thank you. Yeah, we'll try to capture those questions and get answers posted on the COVID work group web location so people can go in and take a look at that.
Yeah,
Thank you all for your
as Nicole mentioned, I mean, this is obviously super important. So we want to make sure that we will definitely capture and share the chat and be able to answer the, get answers to those, and then also create some additional forums for there to be much more time, devoted to this where people can ask questions too, because I know that this is really important, especially as we plan for the future. But in general, thank you so much for providing this really important update. Thanks again to FLY and Classified Development Committee for all your planning for this event. We are going to be having 7 different afternoon breakout sessions using the links that are in the Flex program. So if you don't have that handy, if you go to the Citrus College website and the A to Z list, if you go to F for FLY, you can also get to the links from there if that's easier for you. Your feedback is super important to us, so please check your email later today, possibly tomorrow, for a survey, just gathering some feedback about what you thought of everything and how we can make plans in the future. So your comments will help us guide future planning for Flex and beyond. So enjoy the afternoon and have a great spring term.
Thank
you, everybody.
Thank you, everyone.